Let's move on, shall we? Almost 25 million people in Shanghai are in the second week of a strict lockdown after a surge in Omicron cases. This is the first time that Shanghai has imposed such strict restrictions. I would call them bonkers, ludicrous, deluded restrictions, but it says strict there, so I'll read the word strict out. Anyway, the measures include people being confined to their homes. You have to order in food and drink delivered by the government. I'll pick up with you, James. Because what is going on here is it's like some kind of bizarre movie. They are taking babies and children away from their parents. They are having blocks of people, and you can go down, you get a couple of nominated people that can put their what they call hazmat suits on or whatever to pick up deliveries. They're quarantining people. They're apparently killing the animals of people that have tested positive for COVID. And for what? Well, to try and get the place down to zero COVID, which in my mind is just not going to happen.
Well, there's still plenty of advocates of zero COVID in the UK medical establishment. I hope this will give them pause. You know, it really is lockdown Boris politics, but about 5 times worse. They're going through hell. They're not being bombed and missile struck like in Mariupol, but it's, you know, to not get food or drink for 3 weeks or 4 weeks, you know, to be confined to quarters. I talked to a mate in Shanghai just at the weekend, and I mean, the guy looks grey as a sheet. You know, it's really, really bad. Now, what we can learn from this is that under the surface, a lot of dissent is growing, and not just about COVID in China. The Chinese Communist Party's infallibility is certainly coming under the magnifying glass. There's been some dissent already, you know, senior professors and other people torn apart from their mothers and so on, who are in their 90s, not allowed to see them die and all of this. So Shanghai, which has always been somewhat independent of Beijing and always the most cosmopolitan and internationally minded of the Chinese major cities, could well be, not this year, not next year, but it's going to come where the CCP's rule is challenged, and that will be a great day for the world.
Yeah, indeed. And I was hoping, actually, whilst we're having this conversation, just to share with you some kind of imagery and footage, etc., of what's going on there. So hopefully we'll be able to do that as we're speaking. But Lee, your thoughts?
Well, as you say, it's a lunatic policy. Zero COVID attempts to eradicate the disease once it has escaped a small group of people was totally impossible. So the whole policy of lockdowns and confining the disease, trying to eradicate it and contain it, was based on the success of doing that with SARS in 2003-04. And that was possible because you could very quickly identify who had it, because there wasn't very much in the way of asymptomatic cases or transmission. And so you could identify those people, trace their contacts, quarantine them, and contain the disease. COVID, novel coronavirus that erupted in late 2019, is a very different kind of disease, much more transmissible, and it affects most people very mildly, or in many cases no symptoms at all, and so it spreads much more easily. So once it had spread out of the city of Wuhan and internationally, I think basically the gig was up and you couldn't really contain it anymore. But the World Health Organization endorsed China's approach of lockdown, and so it's spread around the world as a policy model to follow. But what we've learned since is that that was an irrational policy, because you cannot contain it. Eventually, it will spread. So the moment that you start to lift restrictions, it spreads in the community because it's already circulating. The only way that you could absolutely restrict it and get it down to zero would be to engage in a lockdown so brutal that the cost would be completely off the scale. And that's what we're seeing today in Shanghai. So every other country in the world that has had some success in limiting the community spread in the first place by sealing borders, so Australia, New Zealand and so on, they eventually realised they couldn't have zero COVID either, because eventually it slips in and it spreads, especially when Omicron came along. China's now the only country, I think, in the world that is now clinging to this fantasy idea of zero COVID with enormous economic and social costs.
Scarlett?
It's completely mad, isn't it? I mean, we know from our experience that zero COVID is a non-starter. And now that New Zealand, which I have to say is 2 little islands, unlike China, which is massive, couldn't do it. Australia couldn't do it. So it is impossible. It is completely impossible for China to do it. What Shanghai is trying to do is is absolutely terrifying. And you do wonder, James, if there's another reason for it. I mean, given that we know zero COVID doesn't work, we've learnt a lot about
control.
The reason is clear. It is about
control.
It is about control, and I think a lot of this was about social control. But it is also about the fate of Xi Jinping. So he has, to begin with, when the disease spread, there was quite a lot of covering up and non-compliance with the disease control mechanisms, and the centre came down very hard and said, we're going to eradicate this. And so the top-level leaders in the country, their prestige and authority became tied to the policy goal of suppressing the disease. So it's now very difficult for him to climb down the ladder, right? Because he will look bad. He's staked everything on this. And the costs that he's imposed on the country to do this, I mean, this lockdown in Shanghai could lower GDP by 4%. I mean, that shows you what a contribution Shanghai makes to the country. So the costs have been immense. And when and we've seen it in this country the same, when you are so invested in a policy, when you have made immense sacrifices, it's the sunk cost fallacy, right? I've been doing this and I've paid enormous costs, and the costs are so high, I can't admit that I was wrong.
He's got the same on Taiwan as it happens, where you make a promise and then you've got to live up to it. China's other big shocking mistake, although maybe not so shocking, is that although they can be good innovators, they're not all plagiarists. They have failed to develop a vaccination program.
Yeah.
And that's the thing
that vaccination program.
An effective, one that works. I mean, that's one thing we did right. You know, a whole lot better than they ever did. And because they won't vaccinate, they're now forced to these draconian measures.
And actually, what's so interesting, so there were two completely different schools of thought. There was zero COVID and there was herd immunity, neither of which worked. And actually, it does seem the only way to deal with COVID, if it gets any worse, and maybe it won't, is that actually it is vaccination. I mean, the other two extremes just don't work. Herd immunity never stood a chance, like zero COVID.
I mean, herd immunity is not a policy. Herd immunity is simply the end state that you reach when enough people have either developed immunity through having the disease or through being vaccinated.
Having had it twice, I mean, with a lot of people I know having twice. I mean, the problem is that herd immunity doesn't work because COVID changes. It's not a policy, but it was a policy that was thought of, and Sweden possibly really wanted it to work.
Well, I think Sweden has come out of this a lot better than most of the European countries by managing it in a more, with precision, public health. So adopting modest restrictions on social activity and trying to shelter as much as possible the people who are really at risk, and avoiding the total crippling lockdowns that the UK endured. And I think, you know, the data is now coming out to show that they suffered, you know, less excess mortality as a result, and obviously less economic damage and so on. But the other issue around vaccination is they've done very poorly at vaccinating the elderly. So there's immense vaccine hesitancy among the old in China. That's why so many people are dying in Hong Kong. So they've rolled out a vaccine that is much less effective than the Western vaccines, and then they haven't succeeded in vaccinating the most at-risk groups. So there remains a very serious possibility that, you know, eventually this virus will circulate. Eventually, everybody is going to get COVID at some point.
Yeah.
And the difficulty is if you're old and you haven't been vaccinated, that's a real danger to you.
Yes.
Indeed. Well, there you go. I mean, do spend some time having a look what's going on in China if you get some spare time. I've personally found it horrifying.